All right, it is 4 o'clock, time that we get together every single day and remember that we are going to get through this and we're going to get through it together. And maybe I haven't been saying that enough lately, but even with the difficulties we face, even with the challenges and a pretty high death number today, we've got to remember that this is a limited duration. We can't tell you exactly how long we're going to be fighting it, but we're going to get through it and we're going to win. To do it and to do it right, we're going to have to listen to and follow some wisdom. Oftentimes we look at various proverbs. This is a Chinese proverb. One moment of patience may ward off great disaster. One moment of impatience may ruin a whole life. We are all desperate to get back to our old lives. And we have been tested. We have had anxiety. It has lasted a long time. But if we are not patient, we put the lives of other people on the line. We put the health of our economy on the line, and we potentially threaten what we love the most, our children, and their well-being. At a time like this, our patience is being tested. My question is, are we going to pass that test? Today I'm showing off a little additional school spirit. This is from Jessamine County Schools. This is their arts program. They sent this in, one of the very first ones, and we're honoring them and their program today. We appreciate all of our public educators and the good job that they do. We're going to have a pretty packed agenda today, a lot of information. We're going to start off with good news. We have several funding announcements today, and those are all about investments in helping us to get through the current crisis, but also helping to build a bigger, brighter future. Today we had our first task force meeting on agritech, where we've got the ability to create a world-leading industry right here in Kentucky. So just because we're so focused on the present doesn't mean that we're not preparing and doing the hard work to move into the future. To do that also requires that we have healthy local governments, and that's tough with everything that we are dealing with right now. So the first thing we have is another CARES Act announcement about local governments being reimbursed. Today, again, we're highlighting the hard work of our county and our city governments in battling this pandemic. Their work is so critical. Being out there, encouraging and enforcing everyone wearing masks, making the right decisions, knowing that being patient is the difference potentially in life and death of your citizens, but also the well-being of your community. That's why we put that original $300 million of CARES Act money towards our local governments. That is right now, I think, the single largest allocation of that funding. Since Thursday, we've announced more than $18 million to local governments in eastern and western Kentucky, and today we're proud to announce more than $9 million to 11 local governments in northern Kentucky. The governments include the counties of Boone, Carroll, Gallatin, and Pendleton, and the municipalities of Bellevue, Butler, Crescent Springs, Edgewood, Florence, Highland Heights, and Warsaw. The funding can be used to help reimburse payroll expenses, especially related to public health and public safety. These are dollars that these communities spent to try to protect their people, and we appreciate them. So we've had over 200 applications. We've approved over $66 million. We need more applications to come in. So come on, local governments. We know you're working hard. We want to help you out to make sure we can defray your costs and you can get back to doing everything else to improve the lives of your people as we don't ultimately emerge and walk out of this, but we run into the future. We also have federal funding awarded to public safety agencies in the fight against COVID. Today I'm announcing more than $5.7 million in federal funding awarded to public safety agencies in the fight against COVID-19. It's a part of the U.S. Department of Justice Coronavirus Emergency Supplemental Funding Program. That's a mouthful, but it's a lot of dollars that are going to good use. In Kentucky, the Justice and Public Safety Cabinet administer these funds. One-time funding has been directed to 26 public safety agencies that have applied for and been awarded more than $2.4 million. They include things like overtime related to fighting COVID-19, purchasing equipment, hiring and supplies, training and travel expenses, and addressing the medical needs of inmates in state prisons local jails, and detention centers. This is the initial round of awards, and applications are still being accepted. Highlighted award recipients include the Fayette County Sheriff's Office. Sheriff Witt does a great job. These funds will be used for Operation Compassion, a project in response to community needs during the pandemic, which includes delivering food, medication, groceries, essentials, and performing welfare checks for citizens who cannot safely leave their home. What a great program by the Fayette County Sheriff's Office. Really good work and good job. Jeffersontown Police Department. Funds will be used for 2 portable ultraviolet lanterns to properly disinfect vehicles and workspaces. We want them to be safe. Legal Aid of the Bluegrass. Funds will be distributed among the state's civil legal aid programs to provide LegalZoom resources for 83 counties. I hope here in the near future, in the very near future, we're going to have an announcement on our plan on dealing with evictions, providing help to those out there that face them. We're going to need legal aid then more than ever, so exciting infrastructure that they can purchase that helps them stay connected and help other people out there. The Perry County Fiscal Court. Funds will be used for procurement of a 911 server to allow additional flexibility in responding to emergencies during the pandemic. Perry County and the City of Hazard do a great job applying for various grants. They're doing so much with them. In addition, U.S. Department of Justice selected governmental agencies throughout the Commonwealth and made direct awards in approximately $3.3 million. So again, we have CARES Act reimbursements in Northern Kentucky. We have these additional dollars coming into various justice-related entities, and we have $3 million in additional federal transit funding. So this is the Kentucky Department of Transportation, which was awarded $3.07 million to make sure that they can go to 10 public transit agencies around the Commonwealth for new transit vehicles. These agencies serve 41 counties and stretch nearly the length of the state, Pike County to the east to Livingston County in the west. Reliable transportation is essential for all, and this is going to create or be enough money to buy 62 new vehicles. 42 will be replacing old vehicles. The next 20 will actually be expanding public transit. Very important for those communities. They include so many counties. Do we have a slide of who's included? Well, the Bluegrass Community Action Partnership Group, Central Kentucky Community Action Council, City of Maysville, Daniel Boone Community Action Agency, Harlan County Community Action Agency, Louisville Wheels Transportation, Murray Callaway, Penny Ryle, Rural Transit Enterprises, Sandy Valley Transportation Services. So a whole lot of communities that have some dollars flowing in to help fight this virus or provide a better life. All right, the next part I'm going to turn it over and move right over here to the Lieutenant Governor, because today we are celebrating the 19th Amendment, something that took far too long to be passed, to come into law in our country, but one that we can and should celebrate even in the midst of this pandemic.
So Governor Beshear is not the only one with fancy masks. I have one from the 120 Strong group, and I wore it today because this is a group of women who founded and led an organization to help promote public education and public employees across Kentucky. So today marks the 100th anniversary of Kentucky's ratification of the 19th Amendment and our right to vote as women. I'm proud of our Kentucky women and men who made that historic achievement possible. In fact, in 1920, Kentucky had the highest women's voter turnout in the nation at 57%. So to every woman in Kentucky of voting age, I challenge you to join me this November in beating that record 100 years ago. We are in a time of change, and women are coming into their own by standing up for their rights as equal citizens. My 2 girls, Emma and Evelyn, have a much better chance of being part of a society that values their ideas and accomplishments for their worth due to the groundbreaking work that other women have done before them. Great change does not happen overnight. I am here today because of the brave and visionary suffragists that fought for their future and for ours. My children and yours will have opportunities that the suffragists could not have imagined just 100 years ago. We've made amazing strides. Women can realize goals and serve in roles that have previously been far out of reach. However, we still have much further to go. We must recognize and celebrate women of color and of diverse backgrounds for us to fully be inclusive and realize our potential as a society. We must fight for equal pay for equal work. And we must continue to support young women and encourage them to follow their dreams, whatever they may be. Because nothing, absolutely nothing, can or should stop a determined woman. Later tonight, weather permitting, the governor and I will be in Lexington to unveil the Breaking the Bronze Ceiling statue honoring the women of Kentucky. And next year, we will erect the first statue of a woman right here in Kentucky's capital. I think it's fitting that we chose an educator, Nettie Depp, who advocated for improved education for every Kentuckian, regardless of gender or race. So let's live up to her vision. Today, I am honored to introduce Governor Beshear to sign a proclamation recognizing today as the 100th anniversary of the 19th Amendment to the Constitution.
You know, when we do signing ceremonies, you normally hand the pen to somebody that's a part of them. And I held on to this one today because I have a 10-year-old daughter. I have a 10-year-old daughter that deserves a world that treats her equally to a boy or a man in every way. And we still have a long way to go to get there. So for both Lila, who I'm going to give this pen to later, and for Will, let's remember that equal pay for equal work is something we should have done decades ago, but we can still get it done. That we have to make real strides and opportunities available for all women, especially women of color. But if we do more than talk, if we actually take action, then hopefully we can leave our kids, for me, Lila, and I know Evelyn, for the Lieutenant Governor, with a better world. So I'm going to take this one to Lila. All right, we're going to move into our portion now where we talk about the COVID pandemic here in Kentucky. And there's been a lot of talk, I know, in certain counties or areas about, yes, but what's the reality where we are? And we talk about the data not being perfect. We're honest and upfront about that. But we have talked about the fact that the White House each week puts out how dangerous they think the virus is in particular counties. And remember, this is a lot more difficult in Kentucky, where we have 120 counties despite not being one of the larger states. Second most counties of any state. And so, we got to understand that we have more mobility between counties. But here's a little bit of what the White House says. Here are the counties that the White House says are red, that are in an absolute critical and dangerous position. More than a 10%, they believe, more than a 10% positivity rate. And again, this isn't me. This isn't Dr. Stack. This is what the White House is saying. And so there are those who argue with us and try to call us partisan. We're just trying to protect people. But these counties, which include a county that's already started school and others that have voted to go back here shortly, are counties that the White House has stated are in a very concerning place right now. And this is some of the most counties I believe we've had on this list in the last several weeks, and it shows you how quickly it can happen and that this is also spreading in rural Kentucky. This isn't just an urban issue. COVID doesn't care if you live in a city or if you live in a more rural county. It will infect you just the same, And if you have those pre-existing conditions or you just have a bad reaction, it can kill you just the same. Okay, next let's look at the yellow counties. Yeah. This is why we act right now on a statewide basis. That if you add the red and the yellow counties, you are close to, if not over, 50% of the entire state in a state that has very small counties. That's exactly the reason that when we took the actions on bars and restaurants and reduced gatherings to 10 or under, Dr. Burke said you have to do it statewide. She said, I can hand you this report, but when you have this many counties that are in the red or in the yellow zone, you have statewide community spread that is uncontrolled spread of COVID-19. That doesn't mean we can't get it in control. It just means it takes some time and we have to be patient. That patience that can help us avert a disaster. And when you look at these yellow counties, they are all over the Commonwealth. And as an example that shows you how you can move in between, they listed Fayette for a while in the red. They have them currently in the yellow. They do these reports each week. Whether or not we get them in time to show you the red and the yellow counties on Monday, because it comes out pretty late in the day, we will at least do it every Tuesday. So each week we're going to give you this. This is the White House's determination of these counties and where they fall. And so if you are in the red or the yellow right now, I hope that you'll back up from this whole thing and say it's not just the governor and what they're saying, it's also the presidential administration. There can't be politics there. It's people from totally different parties. It's just public health. It's just people trying to say if it's really dangerous in your area right now and it's dangerous throughout the state, we're trying to do the very best for you. I'm going to ask Dr. Stack to come up here and talk about school reporting, but I want to start real quickly with lessons learned. So I started out with the very first slide on patience. And I asked for patience in how we did our reopening of businesses. And I hope that we would be just as patient in what we do to protect our kids here in Kentucky. And the patience just in basically waiting 1 month to figure out the mistakes that other schools make. Teach us lessons each and every day. So a couple things that came out last night or today. One is pretty heartbreaking. 71 of Mississippi's 82 counties are now reporting COVID outbreaks in schools, and dozens of them had just opened for their first day. Now, I'm sure that they had plans on reopening in Mississippi, but isn't it worth considering if someone else has tried what we're going to try, whether it's worked or not? We teach our kids about data and about looking at it, about facts, about pulling together that information that's out there to write a paper or a thesis. Shouldn't we be looking at the same things that are out there? And then we have the U.S. Surgeon General. And while he was talking about UNC, North Carolina, going from in-person to virtual, what did he say? He said the best reopening plan in the world can fail in the face of high background community spread. In other words, where the virus is really aggressive, we can have the best plans, and it still won't work because of where the virus is. And we can change that over time by what we do, but where the virus is today in our state and in our communities, we can't change by just wishing it away or rationalizing it away, which is a lot of what we see. The fact is that I'm the dad of 2 school-age kids, and I'm also governor. My recommendation is about what I see in public health and what I believe is the very best thing to protect our kids. And no matter how much pressure is put on us or what type of theater is created to try to turn this thing political, it is all about the safety of my and your kids. And that's what it's always going to be with me. That's really important. The best plans don't work if there is an aggressive community spread. And as of today, with only a couple of individual schools now reopened, we know that one has already had to move to virtual based on a COVID positive kiddo that we hope gets better. And we now have one superintendent that's tested positive. Again, I'm sure worked on the best plans that he could. I'm sure is trying to follow health advice the best he could. But this thing is so aggressive that it can still happen to people like me. And while I have tested negative, this thing is so hot right now, we have to understand our limitations and have humility in how we address this virus if we're going to protect those around us. So with that, I'll ask Dr. Stack to come up.
Thank you, Governor. So following up on where he left off just now, it's clear that it's been said at the national level about the importance of bringing kids back to school, and we've said it here. This is really not an issue where public health is in any disagreement with education. In fact, public health spends a lot of its efforts trying to help children avoid adverse childhood events that set them up for a difficult life ahead, trying to take steps to ensure they have healthy and nurturing childhoods, trying to minimize and avoid substance use disorders from developing and the consequences that happen, and ensuring that children get vaccinations and improving their health and wellness throughout their childhood and keeping them safe from preventable illness and disease, and countless other things we do. We worry about things that happen to kids in the public health domain that we want to try to prevent. So it's not easily that we recommend that students defer their arrival to in-person class. And this is an area where, even though at the national level there's clearly an emphasis on getting back to school, the Surgeon General himself has said when your test positivity rate goes over 10%, it's going to be really hard to succeed because the disease just spreads too fast. That even with the right plans in place and the best things you can do, there's just too much disease around and your measures won't likely be successful. The federal government in the United States is a little more generous in that. They say over 10%. The World Health Organization says if you're over 5%, that you're going to have a really hard time succeeding. And we've seen that. The University of North Carolina, Chapel Hill, and the collegiate level shut down within 2 weeks because the disease was spreading too quickly. I have the privilege to work with these professionals in the public health domain, and I spoke with the Surgeon General while the governor was starting this press conference right now. He's tweeted and been on record saying the things that I just said, and he affirmed them when I just talked to him now. We're all committed to getting kids back to school. It's important. But we've got to do it safely, and I still have the concern that despite all the time we've spent going through this over 7 months and talking about the difficult and hard things that could happen in a different way if we have this disease take off and fill the hospitals and the harms that happen to people. It's very difficult to imagine what that would look like, and because it hasn't happened like that here, it's hard to believe it would happen here, but it's all these measures we've taken that have kept us so far from having it occur. So we are committed to working as hard as we can in finding the best ways to get kids back to school. I think we will hopefully learn from the lessons that these people do in other states where we see them shutting down schools so quickly and having problems, and hopefully we'll learn from their well-intended missteps where I'm sure they weren't trying to harm anyone, they're just trying to get kids back to school. But I think we've shown in Kentucky, if we go with a little bit more deliberation, we can learn from what others do and do better than they have from learning from their missteps along the way. James, or it's not James, if you could show me my slides, great. So we're still trying to do a number of innovative things in Kentucky here to try to help keep people safe in different ways than having the Q-tip in your nose. And so we are working now, we're about to launch a pilot in 2 of our state correctional centers in the Louisville area to do wastewater testing. And so this slide shows the diversity of the partnership. It's a true public-private collaboration. University of Louisville is involved from an academic side, and we have a number of other partners, including AECOM, which is an industrial contractor that works with FEMA, the Emergency Management Agency. And we are going to start a multi-month pilot program to test the wastewater, that's sewage water that comes from the prisons, which has been shown in other promising early studies to be an early indicator for when disease is present, and it enables us to monitor a population that's confined in an area without having to test them unless we see a warning sign in the wastewater. It also shows up multiple days earlier than people become symptomatic in the confined community. So there's a lot of reason to be hopeful about this, and we are committed to keeping our inmates and the staff that work there safe. And so this is an exciting development for us to work on this. If I could have the next slide, please. I said that there would be a chapter 2. It will be an abbreviated chapter 2 for tonight. Public health has to balance always the need to inform the public so the public can have confidence in the information we share and make its own informed decisions about where they place risk, what risks they are willing to take and what risks they are not willing to take. And we need to empower you as much as we're able to. It's one of the reasons we spend all this time and give all this data and do these press conferences so regularly. The governor has been committed to doing that from the beginning, and I hope you found that helpful. On that previous slide, though, we already give data out in certain communities or populations. We do it with the nursing homes. On this one, on that report that we give, it's that little gray bar or box in the top left is on our website every day, and every day it's updated except the weekend. You click on that, it'll show you all the nursing homes in the state, positive cases, both in staff and both in residents. This at the bottom of the report is for our behavioral health facilities that we operate at the state level. And we also give that same information. Those individuals are more vulnerable. They're not able to leave those communities as readily or if at all. And so we release that information so that the people in those settings and also their family members have that information. That is where we have tried to balance the need for the public to know to make a decision against the privacy or respect for the privacy of either an entity or the people living there. On the next slide now, please. So for K through 12 schools, this falls into a similar category. We are working now to build a process where when a new staff member or student is identified positive with COVID-19, that we will have a communication between the schools and the public health community, either local and or state, and then the school will be given the opportunity to notify their own community. And then once a day, every day, like we already do at these press conferences, we will update a publicly reported school report that shows cases. Now I will tell you, like with all of these things, it will be a work in progress because schools already have to report and do, and you all know this if you're a parent. Kids have lice, if kids have strep throat, they do this already. It's already in statute. There's no new statute, it's already existing. But we're having to build a system to try to do this so that the public knows, because when we do go back to opening up, when people make those decisions, the public needs to be able to know what risk they are or are not taking if their child goes into the classroom. And same thing for the staff, the teachers and the rest of the staff that support the building. And this is an attempt to be transparent, but also to work with the educational community so they have the opportunity first to inform their community and inform what steps are being taken and what they see the implications of that information being. So I look forward to that partnership with the schools, like we do on many other diseases, to try to help keep people safe and keep the public informed. And Governor, thank you very much for the opportunity to share these things, and we'll get through this. And as the Governor says, we'll get through it together, so thank you.
I've heard that before. And just one last piece, and then we'll move into today's numbers. Could you put up Dr. Fauci's testimony, I think, from yesterday? Had something in it that we got to make sure we are mindful of, and that's that public health officials are becoming increasingly concerned that we don't know the full impact and effect of this virus because many people are showing problems months after they have tested negative and supposedly should be better. Dr. Fauci provided testimony on that, especially as related to young people, and I would suggest that people read what that testimony or what his interview was, because again, we ought to be humble. We ought to try to be wise, And we ought to make sure that we know the risks that we are exposing, both adults, but especially our children, too. All right, so today, this is about what we have seen on other Tuesdays, going back 3 or 4 weeks. We're announcing 627 new cases of COVID-19. 76 of them are in Kentuckians 18 years or younger. So again, we are seeing 10, 12, 15 plus percent of each of the numbers every day coming back like that, even though we believe the percent tested is significantly below the amount they make up of our population. That brings our total number of cases to 40,299. Now our positivity rate is down a little bit at 5.48%. That's good, but still over that 5 mark is really concerning. But I believe, again, first we got to plateau, then we can get on that downward slope, and then we are going to be in a much safer place to do things. We currently have 622 Kentuckians in the hospital. Let's be thinking about them. 147 in the ICU. Let's be praying for them. And 88 on a ventilator. Let's be reaching out to their families, praying for both the family and that individual. 9,223 folks that have recovered. New cases by county: Jefferson with a lot today, 131, Fayette 35, Scott 27, Warren 27, Hardin 26, including both an elementary and a high school age kid, and in Warren County, I think we had 4 college age kids. Knox County with 20, Kenton with 19, Boone with 18, Bullitt 17, Franklin and Nelson 16, Montgomery 13, Hopkins 12, Jessamine 10, Callaway 9, including 1 school-age child. I mean, again, this ought to be concerning enough where we are right now, and based on who's testing positive when they likely took the test days ago, to make us concerned, and to make us wear our masks, and to make us do the right things to beat this virus. Today we've also lost 12 Kentuckians to COVID-19. 12. And when you look at this report, it's people of a number of different ages. We haven't had a lot of days where we have had double-digit deaths. What we've suffered from are a few every single day, which is hard, but a day that we have 12 from all over Kentucky is a difficult day. I include a 67-year-old woman from Davis County, a 72-year-old woman from Jefferson, an 83-year-old woman from Jefferson, an 80-year-old man from Jefferson, 75-year-old woman from Oldham, a 72-year-old woman from Perry, 72-year-old man from Jefferson, 84-year-old woman from Washington, a 44-year-old woman from Carter County. I'm 42. Any concept that this just takes old people from us, first of all, that's an awful thing to say, or to believe that it's okay. It's not. But it can impact, and it does impact, everybody. 67-year-old woman from Letcher, a 73-year-old man from Perry, and an 89-year-old man from Graves. Long-term care: 14 new residents have tested positive, 11 new staff, 2 new resident deaths. Thankfully, we don't have any additional facilities to report. Speaking of our children, we continue to see increases in daycare, and these have increased a lot since we began reporting them. 3 new facilities have at least 1 positive test related to them, 5 new staff, and 1 new child. There's still some people out there that think they don't know someone that has had COVID or suffered from it. I'm not one of them. I've had an extended family member in the hospital with it. Thankfully, she's out, and we love her, and we're excited that she's doing better. I've had a friend in northern Kentucky that is now off a ventilator. We're excited that she's doing better. It impacts people that we care about. And today, my senior advisor, Rocky Atkins, is going to talk about how it's impacted his life in a very personal way. This is a reminder that it is very, very real, and none of us should be cavalier, because the next moment it could be impacting your family. Rocky?
Governor, thank you. On March the 6th, I want to take us back almost 5 months. March the 6th, I was walking down a hallway here on the first floor of the Capitol that I've walked for many times, and I met our communications director that said we have our first case of COVID-19. Since that first case today, we've got 40,299 cases of positive for COVID-19. 830 deaths since that very day here in Kentucky. Governor, I've always taken your updates seriously, and Dr. Stack, I've listened to you to try to learn and to try to understand how serious that this virus really is. And I have taken that serious, and I've listened carefully and tried to advise the best I can on actions that should be taken to protect the people of Kentucky, all of our people. While taking it seriously, I really took it more serious a little over 2 weeks ago. A little over 2 weeks ago, on August the 3rd, I got a call from my son that said, your dad's not feeling well. My dad's 84 years old. My son lives just beside of my father. My father lives, and you've heard me talk a lot about the left-hand fork and middle fork. He lives in one of the most rural areas of Kentucky that you could possibly live in. My son called me the next day and said, my dad, 84, strong man for 84, said he's not doing well at all. So from August 3rd to August 6th, my son drove my father to the hospital, St. Clair Medical Center in Moorhead, where he tested positive for COVID-19. He was there for a day and a half, and he was transported on then to UK Medical Center, where he still is today. My son, who, Governor, drove him to the hospital, has tested positive for COVID-19. He has no symptoms. I'm happy to report that his wife and baby of 1 year old, my oldest daughter, and her children and husband have all been tested twice since then, and have all been tested negative. While Brandon still has no symptoms, I'm happy to report to you today that I got a call this morning from UK Medical Center that they are moving my father from the hospital to Cardinal Hill. Now, folks, that's good news, that my dad is going to rehab, where we're going to return him home to take care of that acre garden with tomatoes and corn and green beans that the rest of our family's taken care of. The cruel thing about this virus is that it separates people instead of bringing people together. I can't go see my dad. I've not been in the presence of my father now for over 3 months. When you can't see your grandchildren, when you can't see your own children, when you can't be with friends, that's part of the sacrifice of us really defeating this virus. So on a personal note, if I could leave this with you, and I think you see this guy right here, 50-year public educator, health physical education teacher. He coached me until I was an 8th grader, and he said, I'm not going to put up with you in high school, and let me go. But that is the face of a man who has put his heart and soul into Kentucky, and he would tell you that while he has been very careful, while he wouldn't go into the little Sandy Hook post office with anybody in the post office, while he wouldn't go into any of our little stores if the parking lot was crowded, while he had to stay away from his grandchildren and great-grandchildren. My dad still contracted this virus. And for an 84-year-old man to be able to be in the hospital now for 2 weeks or a little longer, and to be able to fight back the way he has for an 84-year-old man, he's very blessed. And we're very lucky as a family, and we're very blessed as a family that very soon we'll be driving him home from Cardinal Hill to where he can once again be on the left-hand fork and middle fork, but where he can give a testimony like he has for generations of students that he taught, to do what the medical experts tell you to do. And even when you do it, this silent enemy will slip up on you and absolutely do to you what it did to him. Folks, this virus knocked him flat of his back. Without my son living next to him, we may not be here talking even about any of this today. In 2.5 days, he could not get himself off the couch to the bed my son had to carry and to help him. So this is how vicious this virus can be. I wanted to give this personal testimony today, and this very personal story, to hopefully reach somebody across Kentucky. First of all, to tell you by phone call or by someone, check on your neighbor. Check on your neighbor. Make sure they're okay. Check on your neighbor. But second of all, follow the guidelines, the protocols, the orders, all of these things that none of us may like, but appreciate and respect what's being handed down. There'll be time for debate on all of this, but I'm telling you for now, for Jesse Adkins, for an 84-year-old man who will tell you as soon as he can to wear your mask, to wash your hands, to stay away from crowds, to social distance, all of that. This is a personal story, and a story that's going to come out on the good side of an 84-year-old that was able to whip this virus. We're 5 months into this. I'm an old point guard. We got to give it up. We got to gut it out. We got to be a team like we've never been in our lives to sacrifice what it takes to whip this virus and get back to the normal life that we all want to see for our families across Kentucky. Thank you, Governor.
Yeah. Thank you, Rocky, and I hope people out there know how hard that must have been. It made me think about the fact that I can't remember the last time I hugged my parents. It was sometime before March 6th. And my kids haven't been able to either, which I hurt for them even more. You know, none of us know how much time we have with those we love, and especially grandkids with grandparents. This thing can be so mean in taking at least some of the closeness we can have. But we know that by doing the right things, we extend that period of time that they get with them. All right, let's do a little bit of positive, because I still believe, even with the arguments that might be going on right now, and even with our loss, that we're going to beat this thing. We're going to come together. We're going to experience the joy of looking out for one another, and we're going to beat this thing. So we've got some folks on social media that are really showing that they can have a little bit of fun while doing this. This is Camille. She's 5. She was born with congenital heart disease and chronic lung disease. Wear your mask for her. If you don't like wearing a mask, tough. Look at what she was born with, the challenges she faces. I mean, the least we can do is something that we might not like for her. And I love her t-shirt. And that hole here. All right, here's Morehead State University's nursing students performing service hours by monitoring the front of buildings and taking temperatures. If you walk into the Capitol right now, you meet possibly the best greeters that we have ever had. They take the temperature and they don't let you get by without it. They make sure everybody's feeling well. They brought a very special energy to this Capitol. And guess what? At least our team over here has been negative repeatedly, in part because of what they do. All right. This is DuPont Manual's dance team, again, doing the right things. Masks, temperature checks. Again, these are shorter periods that they are together, trying to be able to still come together to do some things, but to try to do them as safely as possible. And finally, this is Common Grounds in Lexington, a store that has been there a long time. I remember it well, being somebody who grew up in Lexington and then just over in Clark County. And they are showing their pride and doing what it takes to protect all their customers. All right, we have an update on prisons in Kentucky, and then we will open it up for questions.
Thank you, Governor. You heard Dr. Stack talk about the pilot program, and that's something that's been in the work for many months as we tried to be innovative about how to protect the staff and the inmates at our prisons. And I'll bring you an update. Today I want to give you where we are and then a really quick overview. Looking week over week, some of the news is positive, some of the news is tragic. On the positive side, in this past week, since August 11th, we've only seen an increase in positive inmate cases of 12. And I would note that 7 of those 12 came from transferees from Louisville Metro Detention Center. And we saw a positive staff increase of only 1. And that brought our total positive testing to a little over 1,010, both staff and inmate. However, we did tragically lose our first death to a staff member. He was a retired person who came back to work part-time as a corrections officer at the reformatory, and he succumbed, and that brought our overall death toll now to 13. But I wanted to take you back looking at inmates in prisons really quickly about how we got here. If you look at the chart, we've had positive tests on inmates from 6 of our 13 institutions. The yellow graph, if you can see it, that indicates our positive testing, and you can see how it started out just a few weeks after the state of emergency was announced, and then rose suddenly, and that sudden rise there at Green River was when we had testing for all of the inmates at Green River. Then we had a flat period. We had that break, and then you see another spike upwards, and that spike upwards, that indicates where we had KCIW, and then right shortly after that where we had the reformatory kick in. Now the blue line is something that I wanted to emphasize, and that is those who have recovered. And if we go to the next slide, you can see that of our total inmate cases at 863, we have 570 that have recovered. Now when I talked about that 1,000, if I added the staff recoveries, we'd be almost up to 800 people who have recovered from it. Well, let's take a look at how it got started. There's Green River. It comes in, boom, we test everyone, it goes through the roof. You look at that period down at the bottom, you can almost see the incubation period, and then you can see the recovery period. Then that blue line goes out, flattens out, and if we go to the next slide, while we did have 3 deaths early on at Green River, we've now had 367 out of 367 recover. Let's go on to the next one. All right, here's KCIW. That's where that spike went up one more time. You can see it kicks in there late May going into June. We had testing. We brought in everybody, we did the test. The cases go up. But the blue line, as you can see, is now approaching where that yellow line was. And so when we go to the next slide, you'll see that of the 244 cases at KCIW, we've now had 196 recover them. And so far, we have no deaths and no one in the hospital from KCIW. So now, our latest area of concern, and that's the reformatory. You can see the reformatory is on that same pattern. It's that spike upwards. It is just now starting to bend over. That 221 hasn't changed for a week now. However, we've had 8 deaths, and I said we also had a staff death at the reformatory. We've talked at length about all the different procedures we're putting into place. We have 7 institutions that don't have an inmate case. We're hoping to keep it that way. But I wanted to show you how the recovery was going and how this does have a very specific trackable pattern. Thank you, Governor.
All right, we will open it up to questions. I know we had a lot today. I think we started on the left yesterday, so we'll start on the far right with Joe.
I have a question about the White House being at the county level. I know that the state has never before said that it had a county level testing data for positivity rate data, but I guess the White House does. Is that data that the White House has and the state doesn't? How does that work?
So the question is, how does the White House get their positivity rate when we believe that there could or would be a high error rate? We don't have exactly how they do their calculations. We have talked to them a little bit about they're pulling CDC data. But while imperfect, we believe it gives a good idea of where the White House, looking at the best data that you have, believes our counties fall into and where the highest rate of concern is. And now we can focus on the individual counties and whether the White House believes it's over 10 or between 5 and 10 or the rest. But what the White House also believes is that we have full statewide spread, and we know that's at least over 5%. Okay.
Is the White House sharing that once a week or daily? Like how often?
Once a week. So we get this report once a week. We get it late on a Monday. So we're going to be sharing this if we can on Mondays. If it comes too late, we'll be sharing it on Tuesday every week. This is, again, these are the counties that they are most concerned about, where they believe that there is uncontrolled spread. Where they believe there is uncontrolled spread, they don't recommend even things that they want to do on the national level. Lawrence?
Walk us through this K through 12 reporting process, and when will you be reporting those numbers?
So the K through 12 reporting process is just an attempt at transparency, the same thing we do to protect our seniors at long-term care facilities. We think we ought to be doing for our kids as well. So schools already have a duty to report. It's just like they have a duty to report lice or some other outbreaks like that. And if you have to report lice, surely you ought to report COVID-19. And it's just very important that we have the right safeguards or processes in place, because even if a school is going back, and I fully expect that we're all going back September 28th, parents have decisions in some places, options, even though some places they're not real options. I talked to a parent the other day whose son has type 2 diabetes. Wouldn't be sending their son back to school, but while that school system is going to offer virtual, none of the AP classes are offered virtually. I'm not sure that that necessarily creates that full choice, but if parents are going to make that decision, they need all of the data that's out there, because they ought to be able to reconsider that decision. If ultimately on September 28th I say, Will, Lila, let's go, and then there are 5 cases in their school, and the next week, before the school does or says anything, I'm going to say, wait, y'all come back, and we'll do our thing from here. So what it's going to do is the school has a duty to report either to us or the local health department. Then they have it's a short window where they get to advise their school community, which they should get to be able to do. They're going to be working hard. Whenever they decide to go back, they're going to be working hard to try to keep it from spreading. But when there is one, they need to report it to the school community. And then it comes up to us, and we'll be reporting it on a spreadsheet the way we do long-term care facilities. That just gives full transparency to make sure that people can know in their own school, but also in a region, what we're seeing out there. Yes, we believe we'll be updating it on a daily basis, as long as we're getting the information in timely. Starting as soon as we get the first one. Does it concern you at all that the age group 20 to 29 is now the largest age group in the state to have contracted the virus? This is college campuses open. Yes, it concerns me. It concerns me because whether you're 20 or 29, under 20 now, they believe that you can spread this virus just as much as anybody else. Folks, it is rationalization to say that just because you're at an age that doesn't have some of the negative outcomes that we see as others, that this isn't a problem. Just about everybody 20 to 29 is going to come into contact with someone who's going to come into contact with people that can be harmed by this virus. This isn't something where it just matters who gets it. Everybody can spread it. And if we see one age group that is out and about more, it's even more concerning because of the ability for it to spread even further. After UNC's results, I'm very concerned. And I hope all of our colleges and universities are watching really closely. And if there develops a problem, let's act. Let's not wait too long. Let's make sure we put our students first. I have every confidence that our universities will do that, but I hope after what we saw at UNC, again, that we learn from it. We got to learn from all of this. This is, I call my kids precious cargo. This is precious cargo that we, as a state, as a school system, as a university, have a duty to protect. Sometimes they call it in loco parentis, which is a Latin term that's sometimes used in the law that's in the place of the parent. So we have a real duty to do everything we can to keep our kids safe and certainly learn from mistakes that are made. Tom?
The Education Committee meeting today, and the school boards and the superintendents, big concern they had over the delay is that each district is different. You can't compare Spencer County to JCPS, that type of thing, and that this really isn't a one-size-fits-all situation. They wish they had more local control on this.
The question is based on a committee hearing today on testimony that one size doesn't fit all. Spencer County isn't Jefferson County. One size doesn't fit all. But if the virus is so out of control that we have over 60 counties in the red and the yellow, and everyone from the federal public health officials to the state say it's too hot on a statewide basis right now, then it's not safe for anybody. And it's not right now. It is not safe for anybody. There will be a point where it may be safe in certain areas and not in others. But that's not where we are right now. And I've heard things like we worked really hard on a plan, and yes, we'll need that plan, and we appreciate that. But every plan has to have its time that it can work. And if the conditions on the ground change and you're not willing to change your plans, you are destined to fail. But let's also remember that most of these plans were developed and approved when our virus wasn't anywhere near where it is right now. And we've never experienced as a state where the virus is right now. Generally where we are in our positivity rate or where we are with our overall cases or the fact that we see it springing up in rural counties real fast, faster than we ever had before, suddenly 20 cases every day for 3 days. So when the conditions on the ground change, hopefully we're willing to change too. And I'll give you just examples of things that we're learning. We've seen in many parts of the country, and this may have happened in Kentucky, we're still investigating, that someone that's tested positive, a kid, and maybe it's because there's been miscommunication with the local health department, shows up to school. Right? That's something that in any plan should stop, but maybe in our plans we don't have the list or knowledge from the people standing at the door of who right now is under quarantine. That's something that I doubt is in everybody's plans and ensuring everybody out those doors knows. That can be tough on bigger schools, but if we've seen it happening, we should be ready to stop it. That's something we can learn by being patient. Hallways are another. We've seen the photos, we've seen the videos. We can ask our kids to do certain things and class changes, but if enough of them are in the hallway for a long enough period of time, you're going to see them running up and down it doing different things. We got to make sure that we lessen the number of kids in hallways at any given time. Well, we're going to be working on updating the guidance based on what we're learning right now. That's why I don't experiment with our kids. We've learned 4, 5, 6 things since others have opened and either had problems or even failed. This is going to help us change our guidance. We know now inside masking is going to need to be mandatory, even if we're able to spread out a little bit based on what we've seen at other schools, and I even think based on some data that we're going to see here in Kentucky. Joe.
Another thing that was talked about around that education committee was the idea of you possibly writing an executive order, something being done to give school districts liability protections. Have you thought about that? What's your ideas on that? Do you think it's a viable option?
I think the question deals with me signing an executive order on liability for schools. I mean, I'd have to look at what they're asking, but I certainly don't want to make it easier to be cavalier and not follow the rules. Could you imagine if I signed an order saying no matter what, there's no liability, and somebody said, okay, no masks, no social distancing, let's go? I mean, we can't do that. And so I'm always going to make sure that we have systems in place that protect our children. And while I have trust in various groups with kids, you don't just trust someone taking care of your kids, right? You verify it. You make sure that babysitter, when we could have them, was somebody that would keep them safe. You call their references. I mean, we want to make sure that we have systems in place that aren't going to promote bad decisions. Instead, they're going to promote good decisions. And so I'd have to look at what they're looking at, but this seems in response to opening at a time when we shouldn't be opening. The answer to our county is red, and we have uncontrolled spread, but we want to open school. The answer can't be, okay, well, let's just limit liability. That doesn't help the kid at all. That doesn't help the teachers that are exposed at all. And it doesn't promote good decision-making at all. All right, Jack Bramer put a question in, so we got to answer this one. Ben Chandler, chair of the State Board of Elections, says the state needs another $9 million to pay for the fall election. He says CARES money, they was specifically targeted CARES money the first time, took care of the primary election, but Republicans in Congress have not provided money for the fall election. If Washington doesn't come through, how will the state pay for its fall election? We're going to make sure we have a safe election. If it requires using some of our other CARES Act money to do it, we'll do it. We came to a good bipartisan agreement that has the most options to vote we've ever seen in a general election, that gives us a chance at having the best general election from a safety and a turnout standpoint that we've ever had. Our Secretary of State should be commended for it. We're going to make sure that it works. And he made a comment today. I think I saw that he hadn't had, that any of the criticism doesn't come from voters. They like the way they're voting. It's just about talking about how other people vote. Listen, convenience is good for everybody. Having multiple options to vote is good for everybody. It doesn't favor one party over the other, and we shouldn't take enfranchisement, people voting, and its safety, and then try to game it along the lines of how many people from this group or that group vote. He did the right thing. I support him. I'm glad we came to that agreement.
In terms of the K-12 plan, what's the nuts and bolts? I guess I don't know if it's a question for you or Dr. Stack, but what's the nuts and bolts plan, I guess, for a parent out there? So, like, let's say a kiddo tests positive in their child's classroom. What are you recommending the parent do with their child?
Right. So if a child tests positive in a classroom, they work with the local health department on determining how long they think that the child has had the virus. And I saw a statement out there today about somebody being asymptomatic and therefore people not getting it from them. Let's make sure, especially if we're in a position of authority, that we do know that asymptomatic people can spread this, and you can spread it before you ever have symptoms. So the first thing is that child's going to have to quarantine. I got to tell you, their parents are probably going to have to quarantine too, based on their exposure to them. But the local health department will work on the level of exposure of people around them, on when they can get them tested again. It is a case-by-case decision based on their activities. They'll also look at the school, how many folks that they have been around, And we're learning about this from other school districts, but our local health departments are generally ready for this. They have some guidance on how to do it. But let's also make sure, I saw somewhere where people are pushing for teachers to be classified in a way to where they come back before we are fully sure that they are no longer capable of spreading the virus. Let's make sure that we don't increase the level of exposures in our schools based on decisions like that. It's good to see you. It's been a while. Yeah.
Thanks for having me. Last week, West Virginia Governor Jim Justice released this color coding system for school districts, basing it on a county-by-county basis. Is that something, have you had the chance to look at that, the Vice President even commenting on this to maybe help get students back in class?
So the question is West Virginia, which nobody's going back until September 8th. I mean, no one in West Virginia, and they've created a color code, a bit fewer counties than we do. And the White House has commented on that. And then the White House to us about Kentucky's situation has talked about uncontrolled spread statewide. And so those same advisors right now are saying that the steps we need to take to get the virus under control need to be statewide steps. There may be a point in the future. Certainly on September 28th, it is my expectation that we will get folks back into class, but that doesn't mean that there aren't areas in the red zone where even with our desire to get people back, if your county falls in the red zone, that there may be other considerations. So I think that we will look at individual circumstances once we get the state in a spot where we have the luxury of doing that. And we are not in a place right now where we have the luxury of doing that. And again, we're going to have to remember that with the size of our counties, having, whether it's teachers or administrators or the vendors for the cafeteria living in a ton of other counties, that we are not, a county just a closed off, isolated area, and that this virus doesn't care about county lines. If we need proof of that, just look at how many cases came back from Myrtle Beach. It'll move with us. Joe.
The SEC announced today that it will allow fans at football games in fall if local laws permit that. Have you talked at all to UK or UFL or colleges about the possibility of fans?
Question is on the SEC and announcing that it may allow fans at games. Depending on local laws. We haven't had the opportunity to talk to them yet. They would have to have a specific plan. We need to look at the capacity requirements, but the number one thing in all of this is enforcement. We have seen it can work if it's enforced. We've seen Lynn Family Stadium set a really great example. But then I've seen a racetrack in South Central Kentucky that's had 4,000 people in stands that look like they hold 1,000 with no one wearing masks and the owner bragging about it, right? So it's not just having the guidelines, it's truly about enforcement. And every time we do one of those things, we make it harder to get our kids back into school in those areas. So I think we had some folks outside. I appreciate their desire to get their kids back in school the other day, but none of them were wearing masks. You want to get your kids back in school, wear a mask. And we're working on it. I want to get my kids back in school. I want to get my kids out of the house, but I'm never going to put their health on the line to do so. All right, what is the status of evictions in Kentucky? I think we will have news on this tomorrow. I'm pretty excited about where it is going. It'll be a bit of a larger process, but I think that we're going to be able to provide some help. Get a lot of agreements and mediate these between landlords and tenants. I think by tomorrow we'll have this thing finalized. Lawrence?
Any assistance, financial or otherwise, to schools that do test positive for COVID?
When a school has a positive case, we want to provide all the help that we can get. Again, given a recommendation that it's not safe, and giving you the data why it's not safe, and repeatedly as a parent saying it's not safe right now. That's my obligation. I think it's my obligation as a governor, as a Christian, as a parent. But even if somebody makes a different decision in light of federal government saying it's dangerous and us saying it's dangerous, and something happens, we want to be there to protect those individuals. So we'll see what type of help's needed, but we're going to do everything we can to protect our kids, our teachers, everybody. Tom?
Seems like almost every day I get another email one unemployment check or no unemployment checks, even though they've been approved. What should I tell these people, and what should I forward them?
Yeah. So the question is on unemployment, and Tom's put out a couple scenarios that sadly the system was designed to create. We have a system, if I can bring people back to where you got to file for unemployment. Once you're approved, you're not automatically in the system. You got to go back online and then sign up for your payment and request your payment. And then every 2 weeks, you've got to get on there and request your payment again. It's designed for people to fall through the cracks, to make mistakes on how it's done. It's designed to tell people no. We have been working E&Y, especially now, on those second or third payment claims. Those are ones we can resolve fairly quickly. We believe we're going to show some significant progress. The system takes about 48 hours to update, especially in our March claims, within a couple of days. I think we got through more than 10% of the remaining claims yesterday alone. Now, I will fully believe it when I see it, but again, that's progress. But you can forward them to our communications office. We'll try to work directly to help.
It sounds like by September 28th, you expect schools, to be able to reopen in-person classes. But given everything with this virus, especially the last month and a half or so, why do you feel like things are going to be different on September 28th?
The question is why on September 28th I have confidence that we're going to be able to get back in school. First, it looks like in the data that we are leveling out, that we are plateauing. We are plateauing way too high, but you got to plateau before you start the decline. What we've seen in most states that have adopted these procedures, but a whole lot of them were hit really hard. And so part of their decline may be that the virus has just hit so many people that there are fewer left to infect. Isn't that an awful position to be in? I'm glad that we're not in that position. I'm glad that we stopped that exponential rise. But if we can continue to do these good practices, we should see that plateau eventually starting to dip and our positivity rate starting to dip. By September 28th, if that has not occurred, then this virus has taken a very different turn. It's not one that I expect. I think if we continue to wear masks, if we all know that this is a goal that we ought to set, and if we work towards it, we can achieve it, that we'll be there. We will also have learned a lot. We'll have learned a lot that will help us operate if we decide to operate at a higher positivity rate. We'll learn the mistakes on how, for instance, somebody who has a positive test, even from a couple days ago, walks into a school. We'll have learned some of the best practices on hallways and classrooms. We'll be in a better position to manage that risk. Let me read one, and then we'll get that last question. Nursing home hit hard in Lewis County, where nearly 50 residents from the same nursing home have tested positive. Are we considering shutting down nursing homes again? I think that means shutting them down to visitors. Our hope is that we don't have to. We are waiting on testing machines coming from the federal government that will provide very quick tests in our nursing homes to hopefully allow for more visitors, but to also be able to regularly test the staff before they come in. We have our system now to try to regularly test staff because that's how it comes in. We hope that we won't have to take that step. But this is still a big challenge. This is still an area where it spreads fast. We think we have the right pieces in place, but this virus, especially when it is this prevalent, can go past even the best defenses sometime. But let me say that we're thinking about all these folks in Lewis County. I know there are a lot of families that are scared. There are a lot of individuals that are scared. We want to work with you. We want to make sure that we protect everybody there.
Just the last question. In our rural counties, Martin County, for example, 9 active cases right now. With them obviously still waiting until September to go to in-person, is there anything the state is doing or working with these districts to help them with broadband and have that internet access for students?
Well, my hope is that this week we will also have an announcement on providing help for internet access. I believe that we're going to have an announcement here very soon. We're finalizing the details. We want to make sure the plan works and has the buy-in of everyone, checking with some superintendents, checking with some county judges, and checking with those that would be providing the service, I think we're going to be able to provide significant help to really, it's about, we think, 5% of Kentucky students that would have trouble accessing the internet to make sure that virtual learning could work. Then we believe that there's going to be some additional help coming probably in the early part of the year because it's coming from the federal government, but that we will be able to deploy not only to help if there are people that have decided to do virtual learning there, but may help in long-term connectivity in some of the areas that we need. But we knew before this that broadband was as important of infrastructure as our roads and as our drinking water, but boy, now do we see it. I'm committed as governor to making sure that every single family in Kentucky can connect to the internet. We seem to live in a world where we see different crises or historic moments on a more and more frequent basis. So let's make sure we have the tools in place for every single Kentucky child, and Eastern Kentucky we are particularly focused on. All right, folks, again, this is another day where we have a lot of cases, but I do think we have the steps in place. Let's make sure that we follow that proverb, though, that we know that if we are patient, if we choose the right time, we can make the best decisions that promote the life and health of our citizens, keep our economy running, and get our kids in the best but also the safest learning environment. You know, most important job to me isn't being governor, it's being a dad. This is all very personal to me, and I want to get my kids in school as soon as possible. My job as governor is to tell you the truth, and that's all I'm doing right now. I want the best for your kids. I want the best for mine. And we're going to continue to provide the right recommendations, regardless of the pressure that's out there. And this shouldn't be partisan. The fact that it seems like everybody falls on this or that is a bigger concern in this country. It's driven by public health, with general agreement from the federal government and the state government. It's simply about doing the right thing and making those best recommendations. Let's make sure, again, that we know that these are the historic times that we're living in, that this is the enemy we have to defeat, and let's be smart about the way we go about it so that we can have that victory at the least amount of human cost. Thank you all very much. Thank you, Virginia.